Did you know when to become pregnant? Every woman has a dream of one day becoming pregnant. Well, in this video, we are going to look at when can you become pregnant. Well, I'm Dr. Siraj, women specialist, and in this video, we are going to look at when to become pregnant. And there are very many different ways or different concepts about when a woman should become pregnant. But importantly is that the day a young girl sees her first period, or what the white man calls menarche, that is the time you are able to become pregnant. But does it mean that at that time, at 12 years when you became pregnant, you'll be able to carry the baby to term and then deliver a healthy baby? No, it's not the right time. So menarche is when you see your first period. However, we are saying you wait a bit, go through the puberty period, enter what we call reproductive age, which is between 18 to 49 years. And this is the timing when you can become pregnant and carry your pregnancy to term and deliver a healthy bouncing baby boy or baby girl. So we are saying all women in reproductive age, which we are quoting as 18 to 49 years, are eligible of becoming pregnant and carrying the pregnancy to term and delivering a healthy baby. So if you fail to become pregnant around this age, you enter into what we call menopause. And in menopause, your ovarian reserves are depleted. You cannot become pregnant after this. So during menarche, or when you just see your periods up to about 17 years, is not right for you to become pregnant. When you become pregnant, there are a lot of consequences. One, you may end up losing the pregnant through what we call an abortion, spontaneous abortion, which we shall discuss in other videos. Two, you may end up, if you become pregnant and carry this pregnancy, you may get a lot of complications and you may either end up losing the baby or even yourself losing life. So what is the ideal timing of becoming pregnant? Is that even though you're married, in between 18 to 49, but what is the best? When you are young, you have a good ovarian reserve. You have a good ovarian reserve. Ovarian reserve means you have good eggs in your ovary. You have good eggs in your store. So we are saying release for us that very good egg that will be fertilized, and that one happens around ages below 35 years. So we say from 18, 19, 20, through up to 34. This is a good timing of becoming pregnant. But what is the best time? The best time should be between 20 to 25. Best timing of becoming pregnant. When you conceive when you're 20 years, up to 25, this is the best time. Or this is when a woman is at the age when they can give the best in terms of pregnancy outcome. Because we are actually not just telling you about when to become pregnant. We are considering that when you become pregnant, what will happen? The pregnancy will progress very well. In what we call first trimester, you not have a lot of problems, which actually has 3 months. Then second trimester also has 3 months. Then the third trimester, when we expect you to deliver. And during delivery, when you are in this age bracket, you will not have a lot of complications. Even then, after delivery, you will be able to conceive again and produce other healthy babies. So in this video, what we want to understand is that the timing of pregnancy, we said, is during reproductive age, that is 18 to 49. But the best timing is when you're 20 to 25. Girls who are at school, we encourage, by the time you are 25, you are done with the university, even when you're doing longer courses like medicine. So we say, the moment you come out, please don't add on a master's before you produce. Because after 35, your ovarian reserve goes down. And usually when we do the AMH levels, anti-Mullerian hormone levels, they are depleted, they are down. And this is a marker for ability to become pregnant. So we are saying, make sure you don't go beyond 35 years when you have not conceived. Because after 35 years, there are a lot of abnormalities like chromosomal abnormalities. You've seen children who have flat face, what we call the Down's syndrome. These all happen after the age of 35 years. So we encourage that you make sure you optimize your early ages of 20 to 25, at most 20 to 30 years if you are to delay. But please don't exceed 35 years. We've seen very many women with problems of becoming pregnant, what we term as infertility. And what's the problem? Reduction in the ovarian reserve. Or you may end up with what we call premature ovarian failure. You become pregnant, but you cannot support the pregnancy. So you end up losing the pregnancy or getting recurrent abortions. This brings to the end of this video. Thank you for watching. And please, if you are new on this channel, kindly subscribe and follow for weekly updates. I remain your Dr. Siraj, women's specialist. Thank you very much.